to go through the midterm review lecture today. So this is a good starting point for you to review for the midterm. The midterm is going to cover the introduction chapter in Module 1. It's going to cover radiology, fluoroscopy, sonography, and CT. And I'm going to go over some of the images here and some of the more common information that you're going to want to know. So starting with, in the beginning, who invented some of these different modalities? Those are some things that you're going to want to know. Modalities like sonography, they don't really have one specific person that they know is the inventor, but for X-ray and CT they do. X-ray was actually the first modality that was discovered in the field of radiology, and the inventor was Wilhelm Röntgen. He discovered X-rays in 1895. And then the inventor of CT was Godfrey Hounsfield, and he invented CT in 1972. So that's when it first became something that we started using for diagnostic purposes. We use a lot of different acronyms when it comes to the modalities and some of the different procedures themselves. So it's really important to know what those acronyms stand for and what we're actually evaluating in them. So we do use them, like I said, quite frequently. Even when you hear me talk in the lectures, I'll say BE instead of barium enema or CT instead of computed tomography. So it's just a lot easier when we're talking and walking through things to know those. So obviously I just said it, CT stands for computed tomography. And there's a lot of different things that CT evaluates. You know, we can look at the chest, abdomen, the head. Those are the three most common exams, but they do a lot of other things as well. Extremities, looking for PEs, anything like that. BE stands for barium enema, and barium enemas are going to evaluate the lower gastrointestinal system, or the colon. Upper GI stands for upper gastrointestinal, and that's exactly what it evaluates. It evaluates the upper gastrointestinal system. So we're looking at the distal esophagus, the epigastric region, the stomach, and where the stomach empties into the small bowel at the duodenum. IVP stands for intravenous pyelogram. So IVPs are used to evaluate the urinary system. We're looking at the kidneys, ureter, and bladder mainly in that. And then the other two acronyms that we have down here are for different modalities. So MR stands for magnetic resonance. We can also refer to it as MRI, which is magnetic resonance imaging. And then we have NM, which stands for nuclear medicine. So those are some that you would want to become familiar with prior to taking the midterm. So we're going to go through some images in this voiceover as well. So what exam is this? You should be able to easily identify this as an OB ultrasound. And then what exam was performed on this patient? This exam is a double contrast barium enema. And the reason that we can tell that is if you look here at the screen, obviously this is a larger colon. There's bigger dilated loops, but we can see the white contrast in here as well as the black, which simulates the air. That's why we consider it double contrast, because they were given two forms of contrast. They were given barium sulfate and air as a second contrast. So remember that barium enema's acronym is BE. There's two contrasts used, barium sulfate and air. And I'll ask you later, but I'm going to ask you again right now too. What is the prep for this exam? So the prep should be for a barium enema. It should be NPO for 8 hours. That means nothing per mouth. For 8 hours prior to the exam, a laxative to clear out all the waste, and a possible enema. So we want to make sure that that person does the prep prior to this procedure. It's really important because if there's waste in here, it can hide disease or anatomy that we're trying to look at. So we want to make sure that the bowel is completely clear of any waste prior to the procedure. What exam was performed on this patient? There's two different images here. These are both upper GIs. Remember what upper GI stands for? Upper gastrointestinal. So These look just slightly different because the image is inverted. You can see the contrast here is white. You can see the rugae of the stomach. However, on this image, the contrast appears black. That's just because they did a modification on the computer itself and inverted the colors on the screen. So again, upper GI, what is the prep for an upper GI? The prep is NPO for 8 hours, nothing per mouth. We don't have to do the laxative or the possible enema on an upper GI because we're mainly focusing on the distal esophagus and the stomach. So after 8 hours, food should not remain in the stomach. It should have moved on, and that's all we're concerned about. So the prep is really important again in this study because we want to make sure that stomach is completely empty. And then again, the contrast used in an upper GI procedure is barium sulfate. It is an oral contrast that we have the patient drink. What exam was performed on this patient? This is an IVP. You can see contrast that's in the kidneys, both kidneys, going down the ureter and into the bladder. So the IVP again stands for intravenous pyelogram, which is what we're doing to look at the kidneys, ureter, and bladder. So we're trying to visualize the urinary system on an IVP. What's the prep for an IVP? The prep is, again, just like the barium enema. It's NPO for 8 hours, a laxative, and a possible enema. And the reason for that is the large intestine, or the colon, lies anterior to the kidneys, ureter, and bladder. So if they're full of waste when we're trying to image the kidneys and the bladder, we're not going to be able to see them because that bowel is going to obstruct our view. So contrast is used to help us better visualize anatomy, such as organs, on the imaging that we use. So two of the main types of contrast we use are barium sulfate and IV contrast material. So barium sulfate can be administered rectally or orally. Our patients can drink it or we can insert it through their rectum. IV contrast is an ionic contrast that is given through an IV intravenously. Ionic IV contrast can cause severe allergic reactions that can actually lead to death. Remember, we talked about those reactions prior. There are normal reactions that can have a patient get a little bit of anxiety, such as that warm flush feeling, a weird taste in their mouth, it tastes like they're sucking on a penny, or feeling like they wet themselves. Those can be normal. But the patient can have other reactions such as hive, itching, their throat swelling, up until anaphylactic shock and or possible death. So those are very extreme situations, but it is possible. So it's important to know what type of contrast is used in the different exams. So an upper GI, or upper gastrointestinal, is barium sulfate. We have the patient drink barium sulfate for that exam. BE, which stands for barium enema. There's two different contrasts that we use. We use barium sulfate that it is administered, rectally, and we also use air as the second form of contrast for that. IVP is a IV contrast material, so it's an intravenous contrast. We use an ionic contrast for that. And then CT, again, it's going to depend on the exam that we're doing. So we use IV, or intravenous ionic contrast, but also possibly we use an oral barium as well. So for a head CT or a chest CT, we're just going to use IV contrast. But for a study like the abdomen, we're going to use a combination of IV contrast and oral contrast. There are some contraindications for the exams, and those can get a little bit tricky when I go in to explain them, because sometimes you can have two exams on the same day, but you have to have them in a very specific order. So the easiest way to try to think about it or to differentiate is, if anything violates the prep for an exam, it's a contraindication, which means that you could not have that exam for the day. So if a patient needs to be NPO for one exam and needs to drink 32 ounces of water for the other exam, then they can't be done on the same day, right? Because that 32 ounces of water violates the NPO prep. Any exam that is done with contrast that could obscure the anatomy we were trying to visualize can't be done on the same day. So like a BE contrast would cover the IVP's anatomy, right? So those two things could not be done on the same day. So if you're asked what might possibly be a contraindication for the exam, I want you to go back and think about that. Does it violate the prep? Or is there going to be contrast in the area that we're trying to view that could be a contraindication? So contraindications for like an abdomen ultrasound are a CT abdomen, because we're giving oral and IV contrast, and an ultrasound abdomen is NPO for 8 hours. So the contrast would be in the abdomen, so that would obscure the anatomy, and drinking something would violate the NPO prep. Same thing for an upper GI. The upper GI, if we have that done first, the patient's drinking contrast, so it violates the NPO prep, and that contrast is going to end up in the anatomy. It's going to be in the stomach, it's going to be in the small intestines, and then eventually the large colon. CT pelvis, again, we're giving that patient IV contrast, so this would all be contraindications for an abdomen ultrasound. So with that being said, a contraindication for an abdomen ultrasound is an upper GI. However, these exams can be done on the same day. The ultrasound would just have to be done first. See, with the ultrasound for the abdomen, it's NPO prep for that, right? NPO for 8 hours, which is the same prep as the upper GI. So if they scan the patient's abdomen and ultrasound first, it's not going to violate anything. Then that person's still NPO and they can come over and have their upper GI done. You just can't do the upper GI first because then the contrast would obscure that anatomy. An upper GI can be done after or a BE, etc. Like all of those different things. You know, you're just going to have to figure out the steps and what violates the prep. And in hospitals, the scheduling committees that schedule these procedures and try to get them done on the same day, they're aware of a lot of that. So they really try to work with the patient if they have multiple exams to get them done in the correct order so the patient doesn't have to make multiple trips back. Another thing that you really want to know prior to going into this midterm is the preps for different exams. So, what's the prep for x-ray? Well, for x-ray, there really isn't any prep per se. The patient may need to remove clothing, jewelry, metal, things like that. Anything that's going to show up on the image, they would need to remove. But we don't consider x-ray having a prep. Fluoroscopy has prep, but it's going to depend on the exam that we're doing. So, for an upper GI, the prep is NPO for 8 hours. For an IVP, the prep is NPO for 8 hours, a laxative, and a possible enema, because we need to clear that bowel of waste so that we can see the kidneys, ureter, and bladder. Same for the BE. The BE is going to be NPO for 8 hours, a laxative, and a possible enema. Again, we're clearing that bowel of waste so that we can see everything and we don't misdiagnose the patient or miss pertinent anatomy. Prep for ultrasound, again, is going to depend on what we're looking at. So for the abdomen, it's NPO 8 hours. We want to make sure that we remove any waste and make sure the abdominal organs aren't contracting. Like the gallbladder, after we eat, it contracts and relaxes, and we don't want that to be happening while we're trying to image it. The OB and pelvic ultrasounds, those are both two separate things. However, they both have the same prep. They're both 32 ounces of water, 1 hour prior to the scan time. The carotid ultrasound requires no prep. So the cardiac, the carotid, thyroid, testes, those exams aren't going to require any prep from the patient. CT, for the head and chest both, they're going to require NPO for 3 to 6 hours prior to the exam. The only reason for that is if they're giving contrast, it can cause nausea and vomiting, and if the patient has food in their stomach or has eaten or drank anything, it can make those worse. So they will still do head and chest CTs if the patient is not NPO, especially in emergent situations. But if it's an outpatient, they prefer them to be NPO for 3 to 6 hours prior. So if you are asked what the prep is for a head or chest, the answer is going to be NPO for 3 to 6 hours prior. An abdomen CT is NPO for 8 hours. So if you're seeing a trend here, anytime you're looking at the abdomen, it's going to be NPO for 8 hours. The CT and the ultrasound abdomen are both NPO for 8 hours. The barium enema and the IVP, which are imaging through the abdomen, are going to be NPO 8 hours, a laxative, and a possible enema. So that's going to be pretty consistent throughout all of them. So with that being said, what is the prep for this exam? We've seen this image earlier. It was an OB ultrasound, right? But what is the prep for it? The prep is 32 ounces of water 1 hour prior to the scan time. What's the prep for this exam? Well, it's the exact same one, just a different image, right? So this is a sagittal or side view of an infant in profile. So you can see forehead, nose, mouth, chin, neck. So this is an OB ultrasound again. So the prep is going to be 32 ounces of water 1 hour prior to the scan time. So this has a two-part question. What exam is this? And what is the prep for this exam? So the first thing you'll probably recognize is that this is a CT scan. So that should be your first indication. Then the second thing we need to do is figure out what kind of CT scan it is. Is it a chest, head, or abdomen? Well, it's obviously not a head. So going through between chest and abdomen, we want to rule some things out. The first thing that you can see right here is this big organ here. If it was the chest, we would see two black circles on each side representing the lungs, right? So just by process of elimination, we can say this is the abdomen. This right here is the liver, okay? So you're seeing the liver in the abdomen and the spleen here. You can see the spine right here. So what exam is this? This is a CT abdomen. So once you figure out what exam it is, then you can determine the prep. What's the prep for a CT abdomen? The prep is NPO for 8 hours, right? Because anything involving the abdomen is going to be at least NPO for 8 hours. So what's the prep for this exam? So I know this has a big arrow pointing to it. This is actually an arrow pointing to a mass on the kidney, on the right kidney. So here's right kidney, here's left kidney, spleen, stomach, and liver. So this is, again, a CT abdomen, and the prep for that is NPO for 8 hours. This is asking you what modality produced this image, and I'm sorry, I know this image is just a little blurry, but you can still kind of get the gist of it. So this is ultrasound. Ultrasound produced this image. This is a Doppler ultrasound. So what it's doing is it's showing the blood flow, and it's measuring the blood's velocity down here. What modality produced this image and what exam was performed? So this again is an ultrasound. Ultrasound is what produced this image. And the exam is a renal ultrasound scan. So renal means kidneys, right? So we're looking at the kidneys here. So you can see the renal pelvis here and the branches coming off. So what exam was performed on this patient? So remember before I told you when you're looking at these CT scans, we know it's a CT, we want to determine whether it's head, chest, or abdomen. Now this whole area here is full of black, and so is this one. So this is actually a chest CT, remember, because air is black. So we're looking at the right lung, the left lung, and the heart right here. So this is a chest CT. The prep for that is what? The prep for a chest CT is NPO for 3 to 6 hours. What exam was performed on this patient? Again, this is a CT abdomen. You can see both the kidneys right here. A little bit of the spleen. Here's the pancreas. Liver starting to show up. And you've got the air in the stomach right here. So make sure that you can differentiate between an abdomen and a chest CT. What was the exam performed on this patient again? This is an abdomen CT again. Here's again the liver and the spleen and the stomach. What exam was performed on this patient? This is a chest x-ray, just a standard x-ray. You can notice the lungs here filled with black, the ribs inside of the lungs. You've got the heart shadow here, coming a little on the right side too, the diaphragm, and the clavicles coming in on each side. So this is a chest CT. What is the prep for a chest x-ray or any x-ray? There really isn't any, right? There's no prep other than removing jewelry if the patient had a necklace on, a bra, clothing with buttons or metal on it. What exam was performed on this patient? So this is an abdomen ultrasound. You can see the liver here. Abdomen ultrasounds are a little bit harder to differentiate. There's not a clear definitive answer of what it is. So I want you to kind of remember this image. If you see it on a test, this is an abdomen ultrasound. What exam was performed on this patient? Well, we can see the large intestine here, and then we can also see that there's contrast and air inside of here. So this would be a double contrast barium enema. And again, what's the prep for a BE? The prep is NPO for 8 hours, a laxative, and possible enema. If you haven't figured this out yet, I'm trying to beat these things into your head so you'll never forget them. I'm really sorry if you're sick of hearing me repeat it over and over again, but I'm really doing it to try to help. What exam was performed on this patient? Again, we can see the black filled lungs here, right, on each side. We're starting to get to the level of the heart here. That's why you can't see it necessarily on this one. But remember, anytime you see the black air, those are the lungs. So this would be a chest CT. What exam was performed on this patient? This is a hand x-ray, right? It's actually a left hand. What exam was performed on this patient? This is an L-spine image, the lumbar spine we're looking at here. Here's L1, L2, L3, L4, L5, and then you've got the sacrum here that attaches to both hips with your SI joints. So sometimes it's hard to differentiate between the L-spine and the abdomen. However, if this was the abdomen, it would be open wider on the side so you could see the borders of the entire abdomen. And then it would be open lower down here so that you could visualize the entire bladder as well, all the way to the symphysis pubis. So that's how you would tell the difference between an L-spine and an abdomen. What modality produced this image? So this is obviously a CT scan, and what are we looking at here? This is the brain, right? So this is the head CT that we're trying to look at here. So moving out of the images a little bit more and into some more information that's good for you to know is, what are the different energies used for each of these modalities? So X-ray uses ionizing electromagnetic radiation, which focuses those X-rays to radiate and penetrate the body and expose a film or an image receiver to produce an image. So remember, X-rays show form, right? And any form of X-rays are considered to be harmful to humans. So we talked about that before, how I said there's really not any true side effects, immediate side effects for X-ray. However, there can be long-term side effects, and any form of radiation is considered to be harmful for humans. Fluoroscopy uses X-ray technology again. However, the difference between fluoroscopy and X-ray is fluoroscopy is live continuous beams, and we also use contrast to help record live videos that show the function of the anatomy. CT, again, uses X-ray radiation. It is a higher dose of X-ray, or higher dose of radiation than X-ray. So X-ray is the lowest dose, fluoroscopy is a little bit higher because it's a continuous live image, and CT is just a little bit more radiation. CT is also the most expensive out of X-ray, fluoro, and sonography. And then the energy used in sonography is sound waves. So sonography uses no radiation. So remember, there's no side effects for sonography. Sonography also uses a transducer. Remember, those transducers are placed on the skin of a patient. They produce a stream of inaudible high-frequency sound waves that are transmitted out of the transducer. They go into the body, they bounce off or echo back off of the organs, and then that transducer receives them and then converts them into an image. So remember, the transducer kind of acts as a loudspeaker and a microphone. You know, the loudspeaker's putting that sound out there and the microphone's picking it back up. Registration is important to know. So who are the different registering bodies for different modalities? So the ARRT stands for the American Registry of Radiologic Technologists. And this is who radiographers and CT technologists are going to go through. So after you complete your 2 years of clinicals and didactic courses, you can go ahead and apply for your registry, take your board exam. After you're done, if you're a radiographer, your initials are going to be your name, or Jane Doe in this case, and then RTR, which stands for Registered Technologist in Radiography. If you pass your CT boards, it's going to be Jane Doe, Registered Technologist in Radiology and in Computed Tomography. Because you have to be a registered technologist to take your board exam in CT, so you'll have both initials. For ultrasound, sonographers are registered through the ARDMS, which stands for the American Registry of Diagnostic Medical Sonographers. So once you've went through your program, did all your clinicals and your didactic courses, a sonographer's initials would be John Doe RDMS, which stands for Registered Diagnostic Medical Sonographer. Some of the directional terms that you want to make sure you know as well are going to be important. So proximal versus distal. Proximal is going to mean something is closer to the midline of our body, and distal means it's further away from midline. So a couple of examples of that would be the wrist is distal to the elbow because the wrist is further away, correct, than the elbow. And then the opposite would be the elbow is proximal to the wrist. Superior versus inferior. Superior means above and inferior means below. So examples of that would be the femur is superior to the tib fib, or the foot is inferior to the ankle because the foot is below the ankle. Cephalad and caudal. Cephalad means towards the head and caudal means towards the feet. So inferior and caudal can be used kind of similarly, and superior and cephalad, because superior can mean above or towards the head and cephalad means towards the head. All right, so go ahead and look over some of your old notes. There is also a Kahoot on JetNet that you can use to help study for the test as well, but this one's going to have some of the images that you may see or very similar images on it.